Hello everyone, I am Dr. Nish Bhatnagar, Medical Director at Avaya Fertility and IVF Center. Today I am going to talk about HSG. HSG or Hysteroslphingography is a basic test to evaluate tubal patency. We all know that if tubes are not functioning well, the egg and sperm cannot meet, it cannot result in an embryo and it will not give you pregnancy. So HSG is a basic evaluation of the tube. In this procedure, the doctor puts a small dye through the cervix into the uterus. If the dye comes out via the tubes into the peritoneal cavity, we say that the tubes are open. During this time, serial X-rays are taken to evaluate the position of the dye and it being expelled into the peritoneal cavity. With this small test, you can know whether the tubes are functioning, not functioning, blocked, open, everything. It's a very basic procedure. Almost all patients going for infertility treatment are recommended to go through one. There are various causes for tubal blockage. This could be tubal infections like chlamydia or sexually transmitted disease, tuberculosis, diseases like endometriosis, or even sometimes fibroids with their location and position can cause pressure and blockage in the tubes. So with this simple test, we evaluate the tubes. You can know whether the tubes are patent, open, that means dye is being expelled out. It is sometimes beneficial in the sense that even if there are some flimsy adhesions, those get cleared by doing HSG, and we see sometimes 3 to 4 months later patient comes back with a spontaneous pregnancy. However, on the other hand, sometimes the HSG test may not be as informative as we would like it to be. For example, the tubes may be open, patent but not functional. If there are some peritubal adhesions or the mobility of the tube is affected, or the tube is not able to pick the egg, or because of the restriction in the adhesions and everything, the tube may not be functioning as it should be. If the doctor tells you that the tubes are not open, you should go and meet your fertility specialist for further planning. Are there any other ways of doing tubal patency testing? Yes, you can go for sonosalpingography. Sonosalpingography is similar test where instead of putting a dye, the doctor puts normal saline and observe the tube through ultrasonography. This is even simpler procedure. Sometimes some patient gets some allergies or rash with the dye, so these are the patients who can go for sonosalpingography. But sonosalpingography is not as informative as HSG. Why? Because you just check for the presence of fluid in the pouch of Douglas, in the peritoneal cavity. You don't know whether it came through the right tube or the left tube. So you don't know whether both the tubes are functioning, one is functioning, another is not functioning. Is there any other way? Yes, laparoscopy. But laparoscopy is not considered a gold standard for testing tubes only. If you need to go for laparoscopy for any other reason, you can check the tubal patency also alongside. But just for checking tubal patency, you should not go and get a laparoscopy done. If you have any more questions regarding this, or you want to get more information about the tubal patency test, please feel free to contact us at the given numbers. You can drop us a message also. We'll reply as soon as possible. Always there to help. Thank you.